I grew up in Victoria, Texas, down in South Texas, and I was raised somewhat out in the country. We had more kind of, I would say, an agricultural background. My father we had cattle, and he also worked in construction. So I came from a very non-medical background. Probably my father had the biggest influence on me in that he was a type of father who was very good at encouraging and always told all of us children that we could do anything we wanted to do in life if we just put our mind to it. I still like farming and ranching, that type of atmosphere. I like working with cattle. I like being outdoors a whole lot, and whether it's exercising or I do hunt, I like hunting. I think I always liked science somewhat through school, and so I think that was a common thread. And I at one point thought of going into veterinary medicine. I went to Texas A&M undergraduate, but I remember distinctly having a conversation with a youth pastor when I was a sophomore in college, and really wanting to have an influence in people's lives and to make a difference. And after that conversation, I was considering actually even going to seminary. And after that conversation, I felt very convinced that medicine would be a way that I could apply some of the scientific skills, I guess, that God had given me to some of the other goals that I felt like were important to make me feel like I had a useful life. I feel like there are men and women who are committed to care, patient care, the way I feel it should be done. And that excellence, I think, comes through and works as a team, and that, to me, is a very attractive thing. I think the most important aspect is treating people like you want your family treated or how you wish to be treated. I think if you can put yourself in a person's situation or in their state of being, whether it's in pain or whether it's with a diagnosis of cancer or whether it's something minor and it's just something that needs to be taken care of, I feel that makes a major difference in how I can take care of someone.